हमने लेडी हेल्थ वर्कर्स को डिप्रेशन, अंडरस्टैंडिंग सुसाइड, उस पर भी ट्रेनिंग दी है. बी अ पावरफुल एजेंट फॉर चेंज बिकॉज कम्युनिटीज़ वेयर वी नीड चेंज. और जेंडर वायलेंस की वजह से भी हमारे यहाँ बहुत सारी जो है सुसाइड्स हो रही है. आई हैव ऑल्सो हैड प्रॉब्लम्स विद क्लेफ्ट लिप एंड पैलेट पीपल. वन ऑफ द मेजर problems now is drug abuse in our children. What are the causes that drive people to reach that stage? Is criminalizing those people who are causing the stress. Action should be taken on that family member. हमने लेडी हेल्थ वर्कर्स को डिप्रेशन, अंडरस्टैंडिंग सुसाइड, उस पर भी ट्रेनिंग दी है ताकि व्हेन दे गो इनटू द कम्युनिटी, व्हेन दे टॉक टू द कम्युनिटी, दे कैन बी अ पावरफुल एजेंट फॉर चेंज बिकॉज कम्युनिटीज़ वेयर वी नीड चेंज. और दूसरा ये है कि अवेयरनेस क्रिएशन के लिए ऑब्वियसली मीडिया हैज़ टू बी एजुकेटेड ऑन इट. एक है जेंडर वायलेंस, और जेंडर वायलेंस की वजह से भी हमारे यहाँ बहुत सारी जो है सुसाइड्स हो रही हैं, स्पेशली इन वुमेन हु हैव सफरिंग डोमेस्टिक वायलेंस एंड हु डू नॉट हैव अ होप ऑफ getting away from this violence because they're too dependent, economically dependent on a husband, and obviously they cannot leave that home, and they don't have a home outside that, a family outside that who can support them when they want to leave that husband. I've also had problems with cleft lip and palate people who have to undergo speech therapy because their speech is not clear and they have a lot of psychiatric problems associated with that. So बहुत सारी चीज़ों में हम ignore करते हैं. We do the surgery for cleft lip and palate, for instance, and think that is it. That's the end of the story. But it is a relatively social problem for those people to associate with in society and to be a part of that society. And that's why I think a lot of other areas that we have to look for. And obviously one of the major problems now is drug abuse in our children. And drug abuse in our children may be associated with various factors. And I'm glad that you all are looking at the reasons why these people are driven to self-harm and to suicide. So really speaking, we have to see how we can prevent, bring about some strategy to see that these people, what are the causes that drive people to reach that stage, and to address those issues rather than just come up with in the latter stage के हमने criminalize कर दिया उसको suicide को decriminalize किया. But the other thing is criminalizing those people who are causing the stress. अगर जेंडर वायलेंस को कोई कर रहा है और उसकी वजह से दैट लेडी इज़ ड्रिवन टू सुसाइड, एक्शन शुड बी टेकन ऑन दैट फैमिली मेम्बर हु हैज़ ड्रिवन हर टू दैट स्टेज. सो आई appreciate all the hard work that has gone into this, and I'm very grateful to PILS and to the National Research Center who are doing a wonderful job in actually getting down to the preliminary and the nitty-gritties of the problems. So again, all my support and help is there, available anytime. Thank you very much for having me here today. Thank you.